My name's Gemma Hyde. I work for the Town and Country Planning Association. We're a charity focused on, to a certain extent, focused on the planning system and with a vision for homes, places and communities in which everyone can thrive. And so I'm a little bit of a curveball. So this morning when the question was, do you work in health? I didn't put my hand up. And when the question was, do you work in physical activity? I didn't put my hand up. I actually could have put my hand up actually for both of those, because what we do is we focus on the fact that where we live affects how we live. And so we think really in the round about physical activity, health in its broadest sense. We think about climate change. We think about, oops, don't do that. Oh no, it might have timings on it. We think about all those sorts of things that make up a place. So the built and natural environment, green infrastructure, all of those. And the reason we think about that is because our environments affect our daily activities and our choices, and those activities and choices have outcomes and impacts. So if you're looking at that, you might think about it in terms of outcomes and impacts for an individual, and a lot of you will work with specific demographic groups that applies to, and you could sort of make those links. But there are also outcomes and impacts at a societal level as well. And so this is what we're sort of interested in. And the Chief Medical Officer said this fairly recently at a conference of ours. So if you look back over the last 150 years, more has been done for public health by proper planning than almost any other intervention, except perhaps vaccination. And that makes a lot of sense when you stop to think about it. You know, planning and public health came from the same sort of wellspring of new professions and new activity in the face of industrialisation. And so we've sort of sister siblings that grew up together, somewhat diverted off on different paths, but I think over the last 10 years in particular have come back together and are working a lot closer together. So my role with the TCPA is actually to be that sort of interface between public health and planning. I do a lot of work with local authorities, looking at policy, local plan policy that embeds health and well-being as a priority into the way we choose to develop our built environment. So planning shapes the places in which people live, and so it shapes their ability to live healthy lives. And this is not unique to our country. Lots and lots of places have sort of come to the same realization all at the same time, and we're all thinking about, well, actually, we're having to deal with pollution and congestion, climate change, the fact that people are not living active lives, that they've got many health issues, and lots of places at the same time have been thinking about, well, actually, how do we think about place in a way that makes it easier for people to live healthier and happier lives? And that brings me to the idea that if we could live locally more of the time, then actually we'd have access to things that we need. We'd be more active and we'd be more socially connected and have better levels of sort of community. So lots of places have been exploring this, and I'm going to give you a few international examples to start with. So the sort of one of the original bits of thinking around this comes from Paris in France, and they've been working on their sort of 15-minute city idea, also known as a city of proximities, or being in happy proximity, which I quite like. And it's thinking about, well, actually, how do we make it so that people don't have to travel from one side of the city to the other in order to do things? And that was really led by the issues that Paris had with congestion. And so they've sort of come up with this idea, and they've been working on it for far longer than us. And if you've been to Paris recently, you'll have noticed a real uptick actually in cycling and walking and wheeling as well. So that's how it started, but as is often the way, when you have a good idea, it then gets applied to lots of other things. So now they're thinking about, well, actually, how do we take our policing model and make that also fit within this spatial idea, and lots of other things like that. Melbourne is another good example. They've been working on 20-minute neighbourhoods. Their starting point was in activity. It was thinking about their levels of heart disease. And so they wanted to think about, well, actually, how do we create places that help people be more active with the extra issue of actually heat? So the climate change, Australia's hot anyway, but climate change has really influenced how they're having to think about how they create and design places. So they started from that point of view, and they've been working on 20-minute neighbourhoods for quite a long time. And then Portland in the US also started to think about, well, actually, we've got lots of people getting in their cars to do short journeys. How can we look at what we've got as a city and where our services and amenities are and how walkable they are for people? And they sort of came up with this heat map, thinking about, well, actually, how do we make neighbourhoods more complete? So we put more of the things that people need in them so that they can easily get around by active travel rather than having to get in their cars, because they don't have a choice in order to access the things that they want and need. A bit closer to home, Scotland have been working on a 20-minute neighbourhood idea, also known as living well locally. And some of that is because as soon as we start to talk about 20 minutes, some people will be like, oh, but I can't possibly do that in 20 minutes. So, and there's lots of definitions. Some people, Melbourne in Australia talked about, well, actually, what they mean by 20 minutes is a 10-minute journey there and a 10-minute journey back. Other places mean just a 20-minute walk or a 15-minute walk in one direction. So we quickly get into the weeds if we focus too much on the minutes side of it. And so there's lots of other language that's come forward in terms of, like in Scotland, living well locally, especially because a lot of Scotland is quite rural as well. So it's really important to think about that. And that's all sort of based around as well this use of something called the Place Standard tool. If you've never played with the Place Standard tool, I highly recommend it. It's a really great way of looking at a place and sort of allowing people to have a conversation about how well it meets their needs across these different domains, and helps you sort of look at the gaps as to where things could be improved. So they started off with this sort of basic one, which is on the screen, but now they've got lots of other sort of ones. So one with a climate lens, one focused on children and young people. It's a really handy, free-to-use, accessible tool. So in the COVID pandemic, we had been working with local authorities a lot, looking at health and well-being, but local authorities were a bit busy during the COVID pandemic, and so we had some time on our hands. So we knew that there was lots of talk about 20-minute neighbourhoods. We knew that COVID and lockdowns had meant that lots of people were suddenly forced to live in their local neighbourhood, perhaps for the very first time, and there were lots of issues and challenges and things to think about in terms of people's different experiences of that. So the TCPA decided that we would look at 20-minute neighbourhoods and think about how that could be applied to the English planning context and in England. So in 2021, we created a guide to 20-minute neighbourhoods, which is aimed at council planners in England, but is actually very accessible to anybody. And we sort of distilled the ideas as we saw them into this diagram. It's not perfect, and I think if we did it again now, we've learned a lot in the last couple of years. But our sort of main message really is that it's about creating complete, compact and connected places. So it is about reducing the need to travel using vehicles, private vehicles, and it is about encouraging active travel. And that we mean in its broadest sense, so walking, wheeling, cycling, but also that connection to public transport in order to move further afield, and to make sure that the connections that people are choosing to use, or that people want to use, are actually there. So far too often, you'll get sort of bolt-on bits of cycleway, or you'll get bolt-on settlements at the edge of an existing settlement, and they just don't link up in the way that they should. And it is making it fun and enjoyable and pleasant, thinking about safety, thinking about shelter, shade, rest, and all the rest of it. And as we see it, there are sort of multiple domains, multiple benefits to this sort of thinking about placemaking, and those work across multiple scales as well. It's probably important to say that none of this is really very new. You know, it's good placemaking and shaping at the end of the day. It's got lots in common with the Garden City movement, and if you know anything about the TCPA, you'll know that that's some of our heritage. And so you can think about the benefits of thinking about place in a holistic way. You get benefits that are social, economic, environmental, and across health as well. And those benefits work from the individual all the way through to planetary thriving. It's quite interesting as well, I think, to think about the scales as well in terms of what we build. So you could have in this one on the right-hand side, you know, the room that you're in, the building that you're in. the street that you're in and work at it that way as well. And I just think there's so many sort of really good ways of thinking about, actually, if we can work in a way and create places that help people to be healthier, it almost doesn't matter where you start, whether you start because you're interested in environmental concerns, if you start because you're interested in physical activity, if you start from an economic point of view, you often come back to this same sort of idea. So there are some examples sort of going on in England. Probably the most developed is Waltham Forest's vision for 15-minute neighbourhoods, quite similar in some ways to what Paris have been doing, because it's a whole way of thinking about delivery of council services. So it is about the built environment, but it is also about how do we deliver health visiting services? How do we deliver how do we think about women and girls' safety? And they've developed lots and lots of things underneath this. And they did a really big piece of work with the Young Foundation to sort of co-create this vision for 15-minute neighbourhoods, which they've now adopted as a corporate priority as a local authority. Another example, which is not as well developed because the local plans have hit some issues being developed, but Rochford and Southend did a piece of work looking at all of their neighbourhoods and thinking about, well, actually, what services do they have? Where are the gaps? Sort of similar idea. Then on a slightly smaller scale, you've got neighbourhood plans who are picking up the ideas. So using the framework of the 20-minute neighbourhoods and thinking about, well, how is what we're doing answering each of these features? And so this is from Tame. And again, it's not using the 20-minute neighbourhood language necessarily, but it is talking about being a thriving town. Then you've got things like Ipswich in Suffolk. So this is being driven by a business improvement district. So they've started from thinking about, well, actually, how do we improve footfall in our town? How do we revive the town and keep it sort of vibrant and viable? And so they've been thinking about, how do we make sure it's really well connected? So once you get there, maybe you do drive or you get public transport to get there, but then how do we make it so that people can, some people will live, but then other people, can they get around? Because it's quite a historic place. There's a really interesting diagram that they've got, which essentially highlights all of the churchyards within Ipswich, and there are an awful lot of them, and sort of links them together in a really nice walking route. And they're just thinking about all these different ideas of how you can make a place more connected so that people stay longer, it's easy to get around, it's enjoyable, and they access the sort of natural assets and anchors that are there. So it's not all plain sailing. If most of you have heard of 15-minute cities, it may be in quite a negative context. There's been quite a lot of challenge and backlash over the last couple of months, really. So it is quite a young concept in this country. Other people are doing more, and we're getting evidence from those places. But here, it is sort of developing still, and there's only a handful of authorities that are really pushing this. And those that are pushing it are doing it in spite of constrained resources and in spite of national planning policy reform, which feels like it's been going on forever. But also, there is a real lack of a national vision as to how we should be making good places. And certainly within planning policy, there is no real health drive, which is an omission which we and many others hope to solve at some point. There are always challenges. When you've got a holistic idea like this, there are always challenges around siloed working, who holds what budget, where people think they can sort of influence and control, and that sort of need for collaboration. There are some real issues around communication. So the idea of 15-minute cities sort of got swept up in a movement around people being concerned about their sort of personal freedom, people perhaps conflating with other things in terms of digital currencies being tracked. I don't know if any of you followed what happened in Oxford in terms of sort of trying to do traffic control measures. So there is a lot of communication that has to be done. It doesn't help that a Member of Parliament also stood up in Parliament and point and suggested that it was going to cost us our personal freedom. So, we've got a lot of work to do in terms of communicating actually that this is about increasing choice. It's not about decreasing choice, and it's certainly not about tracking people, because that's a slightly sore subject with me. I found it really interesting about the bike scheme and the trackers on the bikes, because it immediately put me in mind of this. There is a challenge around the possibility of gentrification. So if you take an area and you sort of maybe do a lot of regeneration work and you don't do that sensitively and with the community, there is a real challenge around, do you end up displacing people and breaking up communities? And there are lots of challenges around what that looks like in an urban area and what it looks like in a rural area. And it will look different, and I think that's okay. It's going to be about actually broad principles. How do we make somewhere more complete, more compact, and more connected? And that's okay if that means in a rural area. It's not about necessarily making sure it's got everything it could possibly need in one small place, but maybe it's about creating clusters of villages or a hub and spoke around a market town, or even thinking about the transaction direction. So, rather than making a village have a bank, is it about a mobile banking service that goes to the village rather than expecting people to drive to the next town to access the bank? So there's lots of innovative thinking going on, and probably lots more that I could say on the subject. That all sounds a little bit sort of not negative, but there's lots to be done, and there is definitely challenge to be overcome. But I think it's worth remembering that most people intuitively resonate with the idea. So despite the headlines, there is, if you live in a city, then maybe this is all very familiar, and you think, well, actually, I already live in one. If you live in a village that's got a good range of facilities, you might think, well, I live in a village that is already this. So there is a lot of intuitive appreciation of the idea, and it's sort of daft if you stop to think about it, that people don't, not many people want to live in complete isolation in a house in the middle of nowhere. So it is about trying to help people enjoy where they live and be more active and healthier in the places that they live. I've sort of whistled through that. We do have lots and lots of resources on our website around this. We have a number of case studies. We've run a webinar series since 2020, which they're all free to watch on our website as well. So if you are interested, it's tcpa.org.uk, and you can find all of those resources. And I'd be happy to be caught by anybody later if you want to ask anything. So thank you.